All right, Dr. Richard Besser, thanks so much for joining me today. It's good to see you.
Nice to be here. Thank you.
So first off, I just want to start with the CDC's new mask guidance. This comes as schools are about to get into session. Here in Texas, we have a governor who said no mask mandates, and now this CDC guidance has come through. Can you help us to navigate maybe what parents should be thinking about and then doing as their kids head back to school?
Well, Sonia, this is a rapidly changing situation. So just as CDC changed its guidance based on the Delta variant, which is spreading so rapidly, is so much more contagious, I hope that state governors who have said no to mask mandates realize that there's room to change, room to change your mind. And the situation that we were in when some governors decided no on mask mandates is not where we are today. It's why CDC changed the guidance. It's because they're recognizing that not only can people transmit this asymptomatically, if they're infected and they have no symptoms, if they're unvaccinated, what they're finding is that there are breakthrough cases in people who are vaccinated, and those individuals, unfortunately, are able to transmit as well. And so given that, it's important that we follow CDC guidance and in areas where there's high levels of transmission, that we put on those masks and recognize that this isn't forever, but it is the right thing to do right now.
You have a background, you're a pediatrician, and so I'm wondering how to talk to children, especially these young children who have been masked and then they didn't have to be masked, but then, oh, mommy, daddy, why do I have to wear this mask? Or why are you wearing this mask again? How do we have that conversation appropriately with these younger children, especially?
Yeah, it's important that you meet kids where they are developmentally. And so that's going to mean a different type of conversation with your high school student versus your elementary school student. For really young children, you get a lot of leeway there in going with, my job as your mom or dad is to protect you, and this is what we need to do now to stay safe. And I will keep you safe. And kids get a lot of comfort from that. For older kids, for high school kids, you're often faced with this sense of invincibility, that nothing can harm me. And they're sharing the information. Why is this change in place? And also appealing to the need to take measures that may protect you, but also protect those around you who may be at higher risk. So it may be that there's a grandparent in the house or someone who either couldn't get vaccinated or has a medical condition where vaccines don't work quite as well. Appealing to that can have real value as well in older children. And recognizing that if we do all these things, if we all step up to protect ourselves, our families, and communities, we will get to the end of this much sooner than if we just let things go without any protection.
It's interesting. I read that only 35% of these teenagers, 12 to 18, who are eligible to be vaccinated have received the vaccine. And so, what do you think is the reasoning behind that? Is it parents? Is it lack of information, understanding, access, a little bit of everything?
Yeah, I think it's a little bit of everything, and it's important. I mean, in some states, unfortunately, we were seeing some governors say we're not going to promote vaccines for teens and tweens. I think that's not a good idea. It's really important that parents, that young people get their questions answered. So go to that healthcare provider who you trust. Ask your questions, get those answers so that you can make an informed decision. Thankfully, COVID is less severe the younger you are, but it doesn't mean that we know everything. We see young people who have long time symptoms following a COVID infection. We're seeing young people who've been hospitalized with this infection. So it is something to take seriously, but it's so important that everyone is able to make an informed decision and that no one feels coerced or bullied or shamed into being vaccinated. That's not the way to get there. It really is meeting people where they are.
As former acting director of the CDC, I'm wondering what your thoughts are on this guidance coming down now. with regard to masks?
Yeah, I think it's a sign that the CDC is paying attention to the science. What I learned yesterday is that CDC has just completed several outbreak investigations, and that's where they learned that people who are fully vaccinated, who get infected, are able to transmit this virus. Still, breakthrough infections are very rare. These vaccines are incredibly effective at preventing severe infection, hospitalization, and death. But the fact that someone who is fully vaccinated could spread this to someone else if they get sick led them to change the guidance. And that's what you want to see. That's called real-time learning. As you learn something, you change the guidance. This is not the last guidance we're going to see. We're going to see more because this situation will continue to change until it's knocked out. And it won't be knocked out until there's vaccines available, not just here across the United States, but around the globe. And we are far from reaching that point.
Yeah, I want to talk about your work with the Robert Wood Johnson Foundation as well. And something, to think ahead to is the well-being of children as they do return to school. Many of them didn't have the opportunity to be in a classroom setting. Maybe for some of them, this is their first time to enter a college setting or even a classroom setting because of their, ages and their experiences last year. So what is the appropriate way to, I want to say, take care of the child holistically?
Yeah. Well, one thing that we've seen over the course of this past year is that this pandemic has affected all children, but not all children equally. Lower income children, Black and brown children, a higher proportion live in communities where schools have been chronically under-resourced. And so many children did not have the opportunity for the level of remote learning that other children did. Many children lacked access to broadband. And so what you're going to see is a lot of kids coming in who have lost ground, and that the gaps in learning have increased. So it's going to be very important to meet kids where they are, to recognize that thousands and thousands of children are dealing with loss of parents, loss of loved ones. And you're going to have to be able to address that with supports and with caring and with learning. But it is clear that the best place for children is in school. That's where you can be meeting children's learning needs, their emotional needs, their social needs. It's so important. And what we've seen over the past year is if schools take the right measures, and it's layered measures, it's not just one thing, it's masks, it's social distancing, it's ventilation, it's promoting vaccination for your teachers and staff. If you do all those things, schools are very safe. What we tend to see is lower rates of transmission in schools than we see in the surrounding communities.
And finally, Dr. Besser, I'm just curious about, again, parents going back to school. They're preparing right now. So within that framework of preparation, and I don't have children, which is why I ask you, within that framework of preparation, are there things that they need to start doing, collecting, even if it's, medication like Tylenol to treat a fever that may pop up, or anything that you can think of, because we've already seen RSV circulating. We're coming into flu season, of course, COVID-19 also circulating. So there's not one issue here. I feel like, September, October, as we kind of come into this time, there's a lot of things that parents are going to be dealing with.
That's right. Yeah, I mean, there is a lot. This is a good time to schedule that appointment that you haven't had over the past year with your child's doctor. Go over, see, are there special medical needs? As a pediatrician, this is usually the time of year where parents are coming in with school forms for medications, for other things. This is the time to make sure that if your child has any individual learning needs, any disabilities, that those are being addressed. That's another thing that we saw during this pandemic, is that children with disabilities, many of them who require specialized services, that those services were lacking. And so getting kids back in school, connecting them with their special needs will be important. And recognizing that there are children where just having a teacher wear a mask is not going to be an effective way for them to learn. Children who may have hearing disabilities, that's going to be challenging, or visual disabilities. Those issues have to be addressed, and everything will not be in place on day one at school. So having some patience, but being persistent, being an advocate for your child, those are all really, really important things. But I think that it is really important for parents to know that your child can be safe in school, their needs can be met, and that's very important. It's important for your child. It's also important for parents who want to go back to work and can't do so because they are working and providing childcare while at home.
All right, I think all excellent points. Thank you so much for your time. I want to honor your cutoff here. So I appreciate it and hope to talk to you again soon.
Thanks very much. I really enjoyed the conversation.
Thank you.
Bye-bye.